Hello, and welcome to our presentation on the role of trauma-informed care in mental health nursing. In this video, my team and I will explore how trauma-informed care helps create safe environments and reduce re-traumatization in mental health settings.
First, we have Chibuzo, who will walk us through the key principles of trauma-informed care. Next, Sandra will explain creating safe and supportive environments. Anom will then discuss recognizing and addressing trauma triggers. Following that, Uche will highlight nurse-patient communication in trauma-informed care. Finally, Harrison will guide us through collaborating with multidisciplinary teams and conclude with the implications of trauma-informed care. Let's talk about the meaning of trauma-informed care, or TIC, before passing it over to Chibuzo. Trauma-informed care is a holistic approach that recognizes the widespread impact of trauma on a person's mental, emotional, and physical health. Instead of focusing only on symptoms or diagnoses, TIC helps us understand how past trauma experiences shape a person's current behaviors and health outcomes. The main goal of TIC is to create a safe, supportive environment where patients can heal and avoid re-traumatization. It emphasizes care that is sensitive, respectful, and tailored to each person's unique needs. According to Goddard, 2021, TIC considers the psychological, physiological, and social dimensions of trauma. In mental health nursing, TIC is essential because many patients have experienced some form of trauma. By applying its principles, nurses can improve patient outcomes, build trust, and empower patients to take an active role in their care. Importantly, TIC helps reduce the risk of re-traumatization by ensuring care is delivered in a compassionate, patient-centered way. According to Owens et al., 2022, this approach fosters patient empowerment and strengthens therapeutic relationships. Purpose of the presentation. This presentation aims to explore the core principles of TIC and its practical application in mental health nursing. To illustrate this, we will use the case of Maria, a 32-year-old woman with a history of significant trauma. Maria experienced both childhood abuse and domestic violence, which have profoundly impacted her mental health. Upon admission to a mental health unit following a severe anxiety episode, Maria exhibited hypervigilance and heightened sensitivity to environmental triggers. Maria's case demonstrates how TIC principles can be effectively applied to create a healing environment, reduce re-traumatization, and empower patients in their recovery journey. Through Maria's story, we will examine the importance of environmental safety, nurse-patient communication, and interdisciplinary collaboration in delivering trauma-informed care. Now, to give us a deeper understanding of the key principles of trauma-informed care, let's hand it over to Chibuzo, who will walk us through these foundational concepts and their application in mental health nursing.
Key principles of trauma-informed care. Thank you for the introduction. Now, let's dive into the key principles of trauma-informed care, or TIC. These principles are the backbone of creating safe, supportive environments where trauma survivors feel empowered to heal. According to Fleischman et al., 2019, TIC is guided by 6 core principles: safety, trustworthiness, collaboration, empowerment, cultural, historical, and gender sensitivity, and choice. Let's take a closer look at each one. 1. Safety. The first principle, safety, focuses on ensuring that patients feel both physically and emotionally secure. This is foundational to trauma-informed care because healing can only begin when patients are in an environment where they feel protected and free from harm. 2. Trustworthiness. Next, we have trustworthiness. Trust is built through consistent and transparent communication. When patients know what to expect and feel that their care team is honest and dependable, they are more likely to engage and open up. This principle helps establish a strong therapeutic relationship. 3. Collaboration. The third principle is collaboration. In TIC, patients are not passive recipients of care, they are active partners. By involving them in their treatment decisions, we promote shared decision-making and give them a sense of control over their journey. 4. Empowerment. Empowerment is about recognizing and leveraging a patient's strengths. Trauma often leaves individuals feeling powerless, but by encouraging them to take an active role in their recovery, we help rebuild their confidence and resilience. 5. Cultural, historical, and gender sensitivity. TIC also emphasizes sensitivity to cultural, historical, and gender issues. This principle ensures that care is respectful of each patient's unique background and identity, acknowledging the impact of systemic and historical trauma. 6. Choice. Finally, we have choice. Providing patients with options helps foster autonomy and self-efficacy. When patients feel they have control over their care, they're more likely to feel empowered and engaged in the recovery process. These 6 principles are not just theoretical concepts, they are practical guidelines for creating a care environment where trauma survivors can thrive. By integrating these principles into our daily practice, we can foster healing, trust, and resilience. Now, let's see how these principles are applied in real-world care settings. Application of TIC principles in Maria's case. Maria's care plan was carefully developed with the 6 core principles of trauma-informed care in mind. Each principle was thoughtfully applied to ensure her specific needs were addressed in a trauma-sensitive manner, fostering an environment that supported her recovery and minimized the risk of re-traumatization. Point 1. Safety. From the outset, Maria's care team prioritized creating an environment where she felt physically and emotionally secure. Recognizing her heightened sensitivity to noise, light, and sudden changes, the team implemented measures to minimize potential triggers. According to Leach, 2017, creating a calm and predictable environment is crucial for trauma survivors. Maria's room was designed with soft lighting instead of harsh fluorescence, and she was placed in a quieter section of the unit with limited interruptions. To provide additional stability, her daily routine was kept consistent, with therapy sessions, meals, and relaxation time scheduled at the same time each day. These adjustments helped Maria feel more in control, reducing her anxiety and allowing her to focus on her recovery. Point 2. Trustworthiness. Building trust was a cornerstone of Maria's care. Trauma often diminishes an individual's ability to trust others, making it essential for the care team to establish consistent and transparent communication. According to Fleischman et al., 2019, trustworthiness is built through honesty and follow-through. Maria's care team ensured she was informed about every step of her treatment. Before any intervention, they explained the procedure, its purpose, and what Maria could expect. For instance, before starting mindfulness therapy, her therapist outlined the process and its goals in detail. The team's consistent actions reinforced trust. When Maria raised concerns or made requests, her care providers acted promptly, demonstrating reliability. Over time, these actions reassured Maria that she could rely on her care team, which encouraged her to engage more openly in her treatment. With safety and trustworthiness as the foundation of Maria's care, the next step was fostering collaboration. In the upcoming section, we'll explore how collaboration empowered Maria and enhanced her recovery process. 3. Collaboration. Maria was not treated as a passive recipient of care. Instead, she was an active participant in designing her recovery plan. According to Goldstein et al., 2024, collaboration fosters shared decision-making, empowering patients to feel more in control of their care. During one of her initial therapy sessions, Maria expressed a desire to develop better coping mechanisms for anxiety and rebuild her confidence in social settings. The care team worked with her to incorporate these goals into her plan, tailoring mindfulness exercises and individual therapy sessions to meet her needs. Additionally, Maria was encouraged to provide feedback and suggest adjustments throughout her care process. This collaboration gave her a sense of ownership over her treatment, fostering empowerment and reinforcing her trust in the care team. Point 4. Empowerment involves recognizing and leveraging a patient's strengths to help them regain confidence and control. According to Fleischman et al., 2019, empowering trauma survivors is essential for rebuilding their sense of agency. For Maria, this meant highlighting her resilience and involving her in decisions about her care. The team celebrated her progress, no matter how small. For instance, when Maria successfully used mindfulness techniques to manage her anxiety, her therapist acknowledged her effort, boosting her confidence. Empowering Maria also meant equipping her with tools to manage her recovery independently. Skills like grounding exercises and self-affirmation techniques were introduced, helping her navigate future challenges outside the clinical setting. Now, let's talk about the principles of cultural, historical, and gender sensitivity as well as choice in Maria's case. Point 5. Cultural, historical, and gender sensitivity. Maria's care team acknowledged the importance of addressing her unique cultural and gender-related experiences as part of trauma-informed care. According to Goldstein et al., 2024, recognizing cultural, historical, and gender-specific factors is vital for creating trauma-sensitive environments. Maria shared that certain cultural practices were important to her healing journey, and her team respected and integrated these practices into her care plan whenever possible. By tailoring their approach to align with Maria's cultural and gender-specific needs, the team ensured she felt respected and understood. This enhanced her sense of safety and deepened her trust in her care providers. Point 6. Choice. Providing Maria with choices throughout her care was essential to restoring her sense of autonomy, according to Fleischman et al., 2019. Offering choices helps foster self-efficacy and empowerment in trauma survivors. Maria's care team ensured she had options in various aspects of her treatment, such as choosing between group or individual therapy and selecting which relaxation techniques to practice. For instance, Maria expressed a preference for individual therapy over group sessions, and her care plan was adjusted to reflect this choice. By respecting her preferences and giving her control over her care, the team reinforced Maria's confidence and engagement in her recovery. Now that I have explained these principles, I will conclude by saying this: by integrating the 6 principles of trauma-informed care, safety, trustworthiness, collaboration, empowerment, cultural, historical, and gender sensitivity, and choice, into Maria's care, her team was able to create an environment that supported her healing and minimized the risk of re-traumatization. These principles demonstrate how TIC can be effectively applied to address the unique needs of trauma survivors and foster long-term resilience. Let me now pass the baton over to Sandra, who will take us through the next topic, creating safe and supportive environments.
Hi. My name is Sandra, and I will be discussing the importance of creating safe and supportive environments in trauma-informed care, or TIC. One of the fundamental principles of TIC is creating environments where patients feel safe, respected, and empowered. For trauma survivors like Maria, the physical and emotional environment plays a crucial role in their recovery. Trauma often heightens sensitivity to environmental factors, making it essential to establish a space that feels predictable and secure. Maria's care plan incorporated several adjustments to ensure she felt safe and supported throughout her stay. Environmental safety and predictability. Maria's care team recognized that trauma can leave survivors feeling disoriented and anxious, particularly in unfamiliar or unpredictable settings. To address this, they focused on creating a structured and predictable environment that minimized uncertainty and fostered a sense of stability. The team developed a daily routine for Maria, including set times for therapy sessions, meals, and relaxation periods. Each morning, Maria was provided with a schedule of her day, allowing her to know exactly what to expect. This structure helped to reduce her anxiety and provided her with a sense of control over her daily activities. For instance, Maria knew when therapy would begin, when she would have time to relax, and when meals were served. Additionally, the care team made thoughtful environmental adjustments to enhance Maria's physical safety. Her room was designed as a calm and quiet space, featuring soft lighting that reduced overstimulation. Noise levels in her unit were carefully managed to create a peaceful atmosphere. Sudden interruptions were minimized to avoid triggering heightened anxiety. According to Leach, 2017, creating a stable and predictable environment is essential for fostering a sense of safety and trust in trauma survivors. These efforts not only made Maria feel physically secure but also helped to build her emotional confidence, allowing her to focus on her recovery journey. Empowering Maria. Empowerment was another cornerstone of Maria's care. Trauma often leaves individuals feeling powerless and vulnerable, which can hinder recovery. To counter this, Maria's care team actively involved her in decisions about her treatment, giving her a sense of autonomy and control over her care. For example, Maria was given the option to choose her preferred therapy techniques and decide the timing of her sessions. When she expressed a preference for mindfulness exercises over group therapy, her care team respected her choice and adjusted her care plan to include more individual mindfulness sessions. Providing Maria with these choices reinforced her autonomy and confidence, key elements of empowerment in TIC. According to Fleischman et al., 2019, empowerment not only helps patients feel heard and respected but also fosters resilience and self-efficacy. By involving Maria in her care decisions, the team helped her regain a sense of control that had been stripped away by her past traumatic experiences. This process of empowerment also strengthened her engagement in her treatment, boosting her confidence and encouraging her to take an active role in her recovery. Empowered patients like Maria are more likely to make meaningful progress toward their goals and build lasting resilience. By prioritizing environmental safety, predictability, and empowerment, Maria's care team successfully created a supportive and healing environment. These trauma-informed strategies ensured that Maria felt safe, respected, and in control of her recovery journey. This highlights the importance of individualized care in trauma-informed nursing and demonstrates how tailored approaches can make a significant difference in patient outcomes. Now that we've explored how creating safe and supportive environments is essential in trauma-informed care, let's move on to the next critical aspect: recognizing and addressing trauma triggers. Anam will guide us through this important topic and explain how identifying and mitigating triggers can help trauma survivors like Maria on their path to recovery. Over to you, Anam.
Thank you, Sandra, for that insightful presentation on creating safe and supportive environments. Next, we'll delve into the crucial aspect of recognizing and addressing trauma triggers. Hello. My name is Anam, and I'll be discussing how recognizing and addressing trauma triggers is a vital component of trauma-informed care. For trauma survivors like Maria, triggers can evoke distressing memories and emotional responses, hindering their recovery. In this segment, I'll explain how identifying triggers and implementing effective coping strategies can create a more supportive environment for healing. Recognizing and addressing trauma triggers. Trauma triggers are specific stimuli, whether sensory, emotional, or situational, that evoke memories or responses associated with past traumatic experiences. These triggers can cause significant distress, leading to emotional dysregulation or withdrawal. For Maria, certain sensory triggers played a significant role in her mental health challenges. For instance, the sound of alarms or the smell of certain cleaning products immediately reminded her of past traumatic events, causing heightened anxiety and emotional discomfort. Identifying these triggers was a crucial step in Maria's care. During her initial assessments, the care team worked closely with her to uncover situations and stimuli that elicited distress. Once identified, these triggers were systematically minimized or avoided within her environment. For example, noise-reducing strategies were implemented, and alternative cleaning products were used to eliminate specific smells. This proactive approach not only reduced Maria's anxiety but also created a more supportive environment conducive to her healing. According to Halaby Najjar and Ackerman Barger, 2024, the ability to recognize and mitigate trauma triggers is a cornerstone of trauma-informed care, ensuring that patients feel both safe and understood. This brings us to the end of the first part of recognizing and addressing trauma triggers. In the next section, I'll delve into the therapeutic strategies that helped Maria manage these triggers, including grounding techniques and mindfulness exercises. Grounding techniques and mindfulness. In addition to environmental adjustments, the care team introduced grounding techniques and mindfulness exercises to help Maria manage moments of distress. Grounding techniques are simple but effective methods used to help patients reconnect with the present moment, diverting their focus from distressing memories or thoughts. For Maria, one effective technique involved using her senses to identify 5 things she could see, 4 things she could touch, 3 things she could hear, 2 things she could smell, and 1 thing she could taste. This practice helped her remain anchored in the present and regain a sense of control during overwhelming moments. Mindfulness exercises complemented these grounding techniques by encouraging Maria to focus on her breath and observe her thoughts without judgment. These exercises helped her develop a deeper awareness of her emotional states and learn strategies for managing anxiety. Over time, Maria became more adept at using these techniques independently, which empowered her to handle stressful situations both within and beyond the clinical setting. By identifying Maria's trauma triggers and equipping her with effective coping mechanisms, the care team minimized the risk of re-traumatization and enhanced her ability to navigate distressing situations. This case underscores the importance of combining environmental adjustments with therapeutic techniques to provide holistic, trauma-informed care. Thank you for listening as I discussed recognizing and addressing trauma triggers. Now, it's time to dive into another crucial aspect of trauma-informed care, which is nurse-patient communication. To guide us through this topic, let me hand it over to Uche, who will explain how effective communication fosters trust, safety, and empowerment in patient care. Take it away, Uche.
Hi. My name is Uche, and I will be discussing the vital role of nurse-patient communication in trauma-informed care. Effective communication is a cornerstone of TIC, as it helps build trust, foster safety, and empower patients to engage in their recovery journey. In this segment, I'll highlight how empathetic communication techniques were applied in Maria's care to create a supportive therapeutic relationship. Empathetic communication. Effective communication is at the core of trauma-informed care, TIC. Empathy, active listening, and open-ended questioning help create a safe space where patients feel comfortable sharing their experiences. Maria's primary nurse employed these techniques to establish a supportive therapeutic relationship. Instead of asking, "What's wrong with you?" the nurse asked, "What happened to you?" Goddard, 2021. This simple shift in language invited Maria to reflect on her experiences without fear of judgment or stigma, allowing her to share her story at her own pace. The nurse also practiced active listening, maintaining eye contact, and using verbal and nonverbal cues to show understanding and attentiveness. Each time Maria shared a distressing memory or expressed her anxiety, the nurse would validate her feelings by acknowledging her emotions and reassuring her that her responses were normal given her past trauma. For instance, statements like, "It's understandable to feel this way after what you've been through," made Maria feel heard and supported. This validation of her emotions played a crucial role in helping Maria feel safe, understood, and less isolated. This concludes the first part of my discussion on nurse-patient communication. Next, I'll explore how trust-building strategies further strengthened Maria's therapeutic relationship and contributed to her recovery. Building trust is essential in fostering a strong nurse-patient relationship, especially for trauma survivors who may struggle with feelings of vulnerability. In Maria's case, transparent communication was pivotal. Her nurse ensured that Maria was informed about every aspect of her care plan. Before any procedure or intervention, the nurse explained what would happen, why it was necessary, and what Maria could expect during the process. For example, before administering medication, the nurse would describe its purpose and potential side effects, giving Maria the opportunity to ask questions or express concerns. This consistent and transparent approach helped reduce Maria's anxiety, as she felt more prepared and less fearful of the unknown. Over time, this transparency built a foundation of trust, enabling Maria to engage more openly in her care. Now that we've explored how effective nurse-patient communication fosters trust, safety, and empowerment in trauma-informed care, let's move to the next critical aspect: collaborating with multidisciplinary teams. Harrison will guide us through this topic and conclude with the implications of trauma-informed care. Over to you, Harrison.
Interdisciplinary approach and shared decision-making. Hello everyone. My name is Harrison, and I will be discussing the critical role of collaborating with multidisciplinary teams in trauma-informed care. This approach ensures that trauma survivors like Maria receive holistic, patient-centered support addressing their physical, emotional, and social needs. Collaboration among multidisciplinary teams is essential in trauma-informed care, TIC, to provide holistic, patient-centered support. In Maria's case, her care team included nurses, a social worker, a psychologist, and an occupational therapist. According to Schimmels and Cunningham, 2021, each professional brought unique expertise to address Maria's recovery comprehensively. For instance, the psychologist focused on her emotional well-being, while the occupational therapist helped her regain daily functioning. The social worker connected Maria with community resources to support her long-term recovery. Together, they developed a unified care plan prioritizing Maria's safety, empowerment, and overall well-being. This interdisciplinary approach ensured that Maria's diverse needs were met effectively, fostering a more nuanced understanding of her trauma and suitable interventions. Shared decision-making. Empowering patients through shared decision-making is a cornerstone of TIC. In Maria's case, she was actively involved in setting her treatment goals, ensuring her preferences were prioritized. During care meetings, Maria expressed her desire to develop coping mechanisms for anxiety and re-engage in social activities. The team collaborated to incorporate these goals into her care plan. For example, the psychologist introduced mindfulness-based therapies, while the occupational therapist provided strategies for managing anxiety in social settings. According to Goldstein et al., 2024, shared decision-making fosters a sense of control, which is particularly vital for trauma survivors who may feel powerless due to past experiences. This collaborative approach not only reinforced Maria's autonomy but also enhanced her engagement and motivation throughout her recovery journey. By actively participating in decisions, Maria felt more empowered, ultimately contributing to her progress. This concludes the first part of my discussion. Next, I will highlight how effective team communication ensured consistency and coordination in Maria's care. Now, let's begin the second part of this presentation, where I'll focus on team communication and conclude with key takeaways. Team communication. Effective communication among the multidisciplinary team was critical in ensuring consistency and coordination in Maria's care. The team held regular meetings to discuss Maria's progress, review her care plan, and make any necessary adjustments. These meetings allowed each member to share insights from their respective fields, ensuring that all aspects of Maria's care were aligned and integrated. For instance, the psychologist might share observations about Maria's emotional triggers, while the occupational therapist could provide updates on her progress in daily activities. This consistent communication ensured that Maria received a seamless and cohesive care experience. Furthermore, regular team check-ins helped anticipate potential challenges and allowed the team to proactively address them, minimizing the risk of re-traumatization. According to Goldstein et al., 2024, ongoing communication among care teams enhances patient outcomes by fostering a unified and adaptive approach to care. Maria's case underscores the importance of multidisciplinary collaboration in trauma-informed care. By leveraging the strengths of an interdisciplinary team, involving Maria in shared decision-making, and maintaining clear communication, her care team provided comprehensive support that empowered her to navigate her recovery journey successfully. This approach highlights the value of teamwork in creating safe, holistic, and effective care environments for trauma survivors. Farewell and reference note. This concludes my discussion on collaborating with multidisciplinary teams and its application in Maria's case. References supporting this presentation are provided in the next section. Thank you for your attention, and I hope this has highlighted the importance of teamwork in trauma-informed care. Goodbye.
References. Here are the references used in this video presentation.